Ya estamos de vuelta. Nos acompaña ahora.
We are accompanied today by Dr. Salim, who is going to talk to us about the importance of telemedicine.
Buenas noches. La verdad que hoy día la telemedicina es un tema.
Nowadays, telemedicine is a theme in vogue. Its application in medicine has been an important revolution for both the public health system and patients. The Internet has revolutionized everything we do in medicine and has brought us closer to the patient. This is due in part to the important role played by the Heart Checker Plus machine.
Todo nuestro quehacer en medicina nos ha hecho ser más cercanos al paciente. Y hoy quizás vamos a hablar de un aparato especial que nos va a unir más hacia el paciente y que hablaremos más adelante.
Bueno, ¿qué aportan las nuevas tecnologías?
What do new technologies bring to telemedicine?
Hoy día, ante la masificación de...
The massification of medicine requires that information be available quickly. Frequently, we need a medical opinion, particularly in an emergency. Even though we have different means of transport, there are certain geographical situations where specialized opinion is needed. For example, the case of acute chest pain. The primary care physician and emergency personnel often lack the tools to make an on-site clinical diagnosis and take important decisions. A patient is often transferred to a specialized hospital because the patient is probably having a heart attack. But on the other hand, the patient may have a chest pain caused by pneumonia and does not need to be moved and can be treated on-site. This can be a life-saving decision for a patient and at the same time make important savings for the public health system. For the primary health care physician on-site, it provides the security and confidence of a clinical decision. It's like bringing the hospital to a doctor who is located in a snowed-in mountain village where land transport is impossible. This is all made possible by telemedicine, which is one of the most important advances we have in medicine today. So we have this emergency physician at one end with a telemedicine appliance and an internet connection which conveys all the vital patient information to the hospital, where the cardiologist or the internist are able to give their opinion, indicate a transfer, treatment, etc.
Por internet puede transmitir toda esta información vital del paciente y mandarla a un centro hospitalario donde allí un cardiólogo o un especialista en medicina interna puede dar una opinión y puede indicar traslado, tratamiento, etc.
¿Y esto lo puede hacer?
All this is possible through this device?
Si este aparato es el Heart Checker.
Yes, this device is the Heart Checker Plus. It's a device for monitoring various vital signs. It automatically takes a temperature measurement and the information is stored on a screen. Temperature and blood oxygenation are measured, an ECG, also a measurement of the TA and glycemia. All these vital signs go to a screen where they are stored. It connects through 3G Wi-Fi and the data is processed through a cloud data store in the Internet. An application in the reference hospital can acquire this patient information by using a password. All this is done in real time and instructions are transmitted to the emergency physician. Today, primary health care can be administered by trained nurses or paramedics in ambulances. Treatment can even be administered while the patient is in transit. A fibrinolysis or a thrombolysis thus save a human life at risk during transit from a heavy, snowy mountain village, from a desert or at sea. It all means we can save a human life. Every year in the United States, 1 out of every 5 deaths is a myocardial infarction, and according to statistics, 85% could be prevented if diagnosed early. Therefore, this is a very important tool to have in favor of our patients' health.
De ambulancias paramédica entrenada puede incluso realizar el tratamiento mientras que están trasladando al enfermo, hacer una fibrinolisis o trombolisis y de esta manera salvar una vida que puede morir en el traslado en un día que está nevado el puerto porque tenemos que trasladar a un desierto o tenemos que de alta mar. Todo esto hace que nosotros podemos salvar esta vida humana. En Estados Unidos, al año de cada 5 muertes, una es por infarto de miocardio. Y según las estadísticas, el 85% podría ser prevenida si se diagnostica precozmente. Entonces, esto es una cosa muy importante como digamos, herramienta más que tengamos a favor de la salud de nuestros pacientes.
So what you are telling me is that if paramedics have this machine, the patient could be receiving treatment while in transit before reaching the hospital, without having to wait.
Esperar todo el rato.
According to a paper published in England, ambulance teams should be able to apply this type of treatment and be able to interpret instructions given by a cardiologist. This is also the case in the United States. They don't wait to reach the hospital if a patient's life is in danger. A trained team of paramedics can perform certain techniques of resuscitation and apply treatment indicated by the cardiologist. The intention is to save lives. 85% of myocardial infarction could be minimized if the patient were to receive treatment on the way to hospital. Many deaths could be avoided if you could diagnose and take measures. In other words, treatment. Many patients simply cannot get to the hospital, or when they do, it's too late. The trend today is that while retransferring the patient not to waste that hour, those 2 hours, and treatment is started using these smart devices that transmit in real time via the internet. Vital patient information to the hospital to save lives. Always relying on the support, perception and treatment from qualified personnel such as a cardiologist.
No haces medidas, digamos, de tratamiento, este paciente realmente no puede llegar al hospital, puede llegar ya cuando es tarde. Entonces hoy día la tendencia es, mientras que estamos haciendo el traslado, no perdernos esta hora, esas 2 horas, sino empezar con el tratamiento, por supuesto, a través de estos aparatos inteligentes que transmiten en tiempo real y a través de Internet toda esta información vital del paciente al hospital, y de esta manera podemos salvar esta vida, siempre apoyando en la opinión y el tratamiento del personal especializado que es un cardiólogo.
Or can it also be applied for personal use?
Este aparato,
This device in principle was intended only for emergencies and primary care attention. What we found is that this device is useful in hospitalization rooms, as it measures all the vital signs, glucose, oxygenation of the blood. TA, hospitalization is controlled in Castilla y León and in most hospitals throughout Spain via internet programs. In our hospital, the Gazelle program stores patients' data over the internet. A physician can have access to patient data from his office through a computer or an Android phone by using a password. A physician is able to monitor temperature and vital signs and follow a patient's evolution. This device fits perfectly in with the efficiency policy, as it saves health staff from having to print out this information. The information goes directly to those internet systems connected to this device in real time and is stored in the systems we have at the hospital. You can avoid a nurse taking a patient's temperature with a thermometer, for example, as this measurement is now instantaneous. No need to measure vital signs or take temperatures, as they are automatically registered, saving time and personnel within the health system. Time is money in a hospital, and resources are limited. This fits in with our methodology for savings and for using fewer resources, while at the same time streamlining healthcare and increasing efficiency.
Nada más ponernos así, automáticamente sale la temperatura y va almacenada. Todos esos signos, el tiempo también es oro en el hospital.
Efectivamente.
Y luego, pues también los recursos no son sobrados. Entonces, pues eso también encaja en nuestro sistema en ahorro de recursos y a la misma vez agiliza la atención, digamos, sanitaria.
Can this device be used at home?
Por ejemplo, hoy
For example, a high-risk patient who might suffer from myocardial infarction whilst living at a distant location. The machine is now being tested through a connection with a cardiologist. As I've already said, this device connects to a computer. It can also be connected to an Android phone. The doctor, being out or at home, may receive information regarding a patient who also may be at home. Of course, there is a certain amount of simple training. It's simple to use. The physician, the cardiologist, can access all the patient information required. There is no need to move the patient to a clinic or a hospital. You can now see all the vital signs. If the patient is in doubt or in pain, the physician can confirm the ECG that nothing is wrong, nothing more than a scare. The patient may be suffering from pneumonia, anguish, distress. Sometimes pain can be simulated as if it were a heart attack. Emergency services are often mobilized unnecessarily, and the patient may be transported to a hospital. If we can actually have that information in real time, the cardiologist is able to give an opinion. It's like bringing the hospital to a patient's home. Today we use the internet and telemedicine in favor of the patient.
Puede ser un ataque, digamos, de neumonía, angustia, agobio, algunas enfermedades veriásicas, Coxsackie-B, otros pueden simular como fuese un ataque de infarto y movilizar médicos de emergencia, trasladar pacientes, todo es necesario si realmente esa información la podemos tener digamos, en tiempo real y puede darnos una opinión el cardiólogo. Esto es como traer el hospital al domicilio del paciente. Eso hoy día tenemos que utilizar, digamos, Internet y la modernidad de la telemedicina a favor del paciente.
We commented that a patient may require some observation, not necessarily in hospital. Also, it may be more convenient should the patient live some distance away. Of course, the idea is that patients acquire this device. Any patient can have one at home, but it's indicated in certain high-risk patients that really need to be controlled. Through these devices, connected with the specialist, your doctor has all the information needed regarding the... Is it being used in Spain? For the moment, we have presented it here in Aranda. In other countries, it has been introduced very successfully. If Aranda were selected, it could become a pioneer in Spain. Of course, here, for example, there are certain villages which are often isolated, and the primary care physician finds himself in a position of great responsibility. Any tool that we put in at the ambulances can only be in their favor. Another important fact is that we have been talking about specialized ICU ambulances. There are also conventional ambulances that do not have a physician, only a nurse and a driver. If all these ambulances were to have the Heart Checker Plus appliance installed and adequate training were undertaken, it would increase the possibility of saving more lives, which is really what interests us.
Otro, por ejemplo, dato que es muy importante, hablando con gente especializada en ambulancias, me decía que hay UV móvil, hay ambulancias semi, donde no tiene que estar ahí un médico, sino una enfermera y un conductor. Todos estos ambulancias, teniendo un aparato de ellos, realmente que estamos potenciando sus posibilidades, porque ellos, si están bien entrenados como personal paramédicos, pueden realmente en el traslado de Huerta del Rey o de cualquier pueblo de Alcayo a Burgos, pues se pueden aplicar un tratamiento y probablemente salvar la vida humana del paciente, que es lo que más va a nosotros y para el paciente lo que más vale.
Vamos a resaltar.
Let's highlight how much the whole machine weighs, 1.5 kilos. It's a portable suitcase, which allows us to move quickly. No need for cables or electricity. It has an independent battery and connects through Wi-Fi, 3G or 4G mobile communications.
Él conecta a través de Wi-Fi, si no hay Wi-Fi hay 3G, 4G, o sea que...
vemos que una cosita de...
So what remains to be said of the appliance?
¿Podría salvar multitud de vidas?
Muchísimas vidas. Es a mí lo que me ha alucinado este aparato.
Nothing really. We are just trying to make it available to both the public health system and private health services. This device will be a revolution and one more tool, but most importantly, it is the specialist who must determine the diagnosis. These tools are a means to bring high-risk patients closer to the hospital by providing quick and efficient solutions.
Esté a disposición del sistema de salud pública y privada y este aparato va a suponer una revolución y una herramienta más, por supuesto. Lo más importante, y siempre lo digo, es el especialista el que tiene que determinar, porque su diagnóstico es lo más importante, pero esas herramientas siempre le acercan más a su paciente, que es lo que queremos ser, muy cerca de nuestros pacientes y poder aportarles soluciones rápidas.
Pues, doctor, muchísimas gracias.
Well, thank you, Doctor, for introducing us to this new and exclusive apparatus.
Pues muchísimas gracias a vosotros por vuestra amabilidad. Muchas gracias.
Gracias. Y bueno, hasta aquí llega nuestro programa por hoy. Recordad que podéis seguirnos a través de Facebook y en Twitter en @teleranda. Volvemos el martes que viene.